We know the mouth and the head is really connected to the rest of the body. We also know that many times we see oral manifestations of disease or non-health prior to anywhere else in the body. So we're a little bit of an investigator when we see patients. And we know the importance of oral health, of good oral health as well, because of the links with diabetes. We know it can complicate Alzheimer's and dementia, chronic kidney disease, and these are all according to the ADA. All of these systemic conditions can affect oral health. Likewise, oral health can affect these conditions as well. We have to talk about prevention. So if it's something that's intrinsic, systemic, like reflux, GERD, if you suspect it, please don't hesitate to refer, just as you would refer out for things like oral cancer screening. If you suspect there's an issue, encourage them to see a medical doctor. Many of our patients come to see us on a regular basis for dental, but it's been years since they've had a physical. And we may need to figure out a way to mitigate the effects of the acid exposure with oral rinses, gels, and so forth. That oral hygiene routine and what they do between visits is so critical. If it's bulimia, refer for therapy, but listen, be compassionate. And if you suspect airway issues, if you don't treat it and screen for it, refer them. We know the implications of sleep apnea are far-reaching in longevity of life and overall health and wellness. Exposure is a key part, and sometimes changing just the smallest factor, like water between meals. I often turn to the patient and I say, I like that glass of wine just as much as you do. The best way to have it is with a meal rather than sip on it for hours, and tell them why. We're also going to look at assessing salivary factors, and we're going to use products that assist that if needed. If they have a low salivary flow, then we need to recommend a salivary substitute and probably consider something to help protect what we do have on the dentition. And definitely address the cause of sensitivity. There's a lot of products on the market. There's a lot of products if you look online, and many times patients are confused. They don't understand why or what to choose compared to the other 10 things that claim the same thing. So look at your toothbrush selection. You want bristles that are going to be effective, and you want it soft that's not going to damage the restorations, the natural teeth, or the gum line, because we know we need to focus on the gum line, and we need to educate our patients to do so. Oral irrigators or water flossers are also very, very effective, and I highly recommend those to my patients that have extensive restorations or have periodontal disease. Interdental brushes, as I said, is one of my go-to options. Floss picks, soft picks, wooden picks. The key is to find something your patient will use and to be effective. I often will send them with about 3 options, and I'll tell my patient, I would like you to try them all and figure out what works best for you, and then go with that moving forward. Will you call and tell me what that is so I can make note? So it gives your patient action items. As far as mouth rinses, I almost always recommend an alcohol-free rinse. Chlorine dioxide rinses, but definitely an alcohol-free. Much of our society is on medications, or they have xerostomia to some extent. The heavy alcohol rinses can complicate that and make that xerostomia and that dry mouth worse.